Guys, we're back with VE. Now, this vaginal examination is in Gyn. So, under Gyn, meaning that dealing with abnormalities, perhaps this lady was pregnant, then there was an abortion which occurred. You're supposed to examine the vagina. Then you can also examine the vagina in case there is a cancer of the cervix. You can also do that. Maybe if there is a PID, which is pelvic inflammatory disease, you can also do a vaginal examination. So you can do vaginal examination even when the woman is complaining of any discharge that you can't understand. You can try and perform an examination. So you can do such. Now, what are you supposed to really focus on when you try to do this examination, trying to look at the cervix? Okay, you're trying to see, so meaning that your fingers will help you imagine what is behind there. So we look at the cervix, because the cervix was supposed to say that, okay, it's supposed to have a dimple thing there and supposed to be closed in normal circumstances. Now you do VE, you find that it's open. Why is it open? That's the question, meaning there is something wrong. Then you try to feel around it, you discover that the cervix is hard, meaning is there inflammation or what has caused the structure to change its maybe texture. So those are the things you're supposed to really look at. Then around the cervix, there are structures which we call fornices, or just spaces we call fornices. There are lateral fornices, which are one, two. Then there's also what we call anterior fornix and posterior fornix. When you feel around the cervix, that structure should be soft as well. Now, if it's hard, in case you're doing the VE, you discover it's hard, meaning what has caused the structure to change its texture. So meaning there should be a problem. So those are the things that we have to look out for. Then apart from that, you're supposed to look at the vulva itself. Does this woman who is complaining of maybe pain or something has warts? Or do they have sores? Or what is really causing them to complain about their vulva and maybe inside the vagina? What is really causing, maybe even the bleeding? So that's what we really focus on. So it's just the vulva to assess what is there on top. Is it warts, sores, and any other abnormality? Then inside, you just focus on the cervix. Is it open or closed? Is it hard or soft? Then also look at the fornices. Are they hard or soft? So what has caused the structural change in that case? So that's what we are really going to look at. The examiner won't really have that opportunity to find out what you are talking about. So it's you to tell the examiner what you have found out. So let's move on. Let's see how it's done. Okay, so we start as usual. Okay, so we do the hand washing for us, then you go to the patient. Good morning, Mrs. Mwale. I'm student number 2 from Kalolushi College of Nursing. I've been assigned to do vaginal examination. May I please go ahead? She has said I can go ahead, okay? So before I start, is there anything I can do? Nothing. So even in this case, you never know what's there. Maybe there are secretions, so you can't just go and touch with your bare hands. You need to wear gloves. So before you wear gloves, prepare what to use, okay? We're going to use Savlon, okay? So Savlon is for doing vaginal swabbing, okay, or vulva swabbing, sorry. So you're going to swab, and then this is obstetric cream. This cream is there so that you don't have difficulties while inserting your fingers, okay? From there, you can wear gloves. Okay, so you can wear gloves so that you assess the patient. You can't just go there because you might find secretions. So with this done, you're supposed to carry the inco sheet, okay? And then put this lady, or position the lady in a dorsal position. So dorsal position is a preferred position for this examination. So just, okay, Mrs. Mwale, fold your, or just flex your knees, okay? That. Then you place the inco sheet down there and allow the woman to be like that. Now, since you're going back to scrub, at least privacy is supposed to be considered. Cover the woman with a bed sheet. Okay, this is Molly. I'll be right back. Let me just scrub, or let me just prepare. Okay, so you just remove those and go for scrubbing. So scrubbing for OSC is pretty quick. You're supposed to do it fast. Okay, you go like that. So don't waste time here. Just 1, 2, then go lock up to the elbow, scrub, but ensure that you have some soap so that the examiner are satisfied. You do that, then close, or your assistant can do the job for you. Then drying of hands, same procedure. Start with the fingertips. Ensure that your fingers are dry. Then in between your fingers, up to your wrist. Then you can go behind your hand, do that. Okay. So you see as we do written demonstrations, it's very nice to be in front and perform the procedure. Okay, so just compose yourself and ensure that you are just following just those simple steps. Okay. I know some students are scared of contaminating, but just compose yourself and do the procedure. Okay, so you throw this down there. Then you don gloves. As usual, the same way, don't hold this part, which is sterile, just hold here. Okay. Okay, like that. Then you can get the other one, pick, and don. Okay. So after having done this, you can prepare the swabs. Since you're doing VE, you don't want to take in Savlon using these 2 fingers. So you can use the left one, okay, your left hand, and do that. Okay. Just since this is not the main deal is not vulvar swabbing. So use just a swab to show that you perform vulvar swabbing. So at this moment, I'll ask my assistant just to expose the patient for me. Please, could you please expose the patient for me? Okay, so then the vulva is exposed, so you can drape. So the draping stance, you go furthest. Okay, then you go to the abdomen. Then you end up with the nearest. So this is how you drape. So in this case, you're supposed to just at least try to expose a little bit so that you're able to see. Okay, so this whole thing is just an imagination because this is a dummy. So you'll be able to imagine what to say to the examiner. You're trying to imagine. So we're trying to get to a point where we see if you have knowledge about an examination. So it's an imagination. So everybody will try to imagine what you'll be saying and what you'll be doing. So let's see. So with your left hand, you swab. Okay, so okay, I'll perform vulvar swabbing, top to bottom, just 1 swab. Okay. Then with this hand, you go and dip them in obstetric cream. So obstetric cream is there. So 2 fingers in obstetric cream. Okay. There's obstetric cream here. Then now you go or you put your fingers in the vagina. So before you put, you need to, first of all, like I said, you need to ensure that you tell the examiner what you see. So in this case, there are no warts there, and the vagina is not covered by maybe say warts or sores up there. So nothing is there, say sores, warts, or varicose veins. So now you can take in your fingers. As you take in your fingers, be able to now imagine and give the examiner that imagination to say, okay, this is what we are talking about, and we are in one accord. So when you go in, just like that, you reach the cervix. So you tell the examiner, say, okay, the os is closed. Okay, you are trying to examine. The os, the subcervical os, is closed. Okay? Then it's not hard, meaning the meaning is that it's soft, okay? You can say, okay, the cervix is soft, it's not hard. If it was hard, what's causing then the structure change? So just say it's soft. Then round the cervix, there are fornices. You can tell the examiner to say that the fornices are soft. So meaning they are not hard. Okay, if the fornices were hard, meaning it was going to be like what's causing the structural changes to the fornices. So in this case, the fornices are soft. The cervix is soft, the os is closed, the fornices are also soft. Meaning, as you bring out your fingers, you come out and maybe look at the discharge and say that, okay, The discharge, say, okay, it's, maybe the discharge is whitish, depending on what you find. If it's brownish, you can say, okay, the discharge is brownish. So just give the examiner the color. And then what about the smell? Is it foul smelling? So you can feel something foul smelling. Even from here, you can tell, okay, this discharge is foul smelling. So that's what you are supposed to tell the examiner. At least two things: the color of the discharge as well as the smell you can mention. So those two things, you are trying to imagine what you can do in the real situation. So this is the procedure. So lastly, you can also perform at least another vulvar swabbing, but then it's not the core business here since it comes as a separate procedure. So just do one swab like that. Then you're done with the procedure. Remove all these and thank the patient. Thank you very much, Mrs. Mwale, for allowing me to do this procedure. I'm doing this procedure so that I know what is really the problem. Okay, so I'll be coming so that we do the procedure. So if you have a pad, you can also put a pad because there's vaginal discharge, so you can put a pad there so that the patient is left comfortable. Okay, so you can go now to the examiner, explain what you have done to the examiner, and tell that you have left the patient comfortable. Okay, and then lastly, you are going to document. Okay, document. Don't forget about the free marks. The free marks are washing hands. So this is very much free. In every procedure, hand washing is free. Okay, they give you free marks. If you don't wash hands, you lose them. So that's what you're supposed to do. So what you're going to do is you're going to just practice so that you get to know the steps to follow, because you can get confused if you're not practicing. So thank you very much for watching.